final speaker of this morning or this afternoon, wherever you are in the world, is from our own ranks, is Guus Reurink. He's a sports medicine physician and a human movement scientist, and currently a postdoctoral researcher within our own ranks. He takes care of, amongst others, the football players at our Amsterdam football club Ajax, and he's going to tell us a bit about his experiences during these challenging times. Guus, you're up.
Yes, thank you, Evert and Gina, for the invitation. Today I will talk a little bit about the challenges and practical pearls we experienced at Ajax Football Club in the past period regarding the COVID issues. And I hope that our experience may help others to manage these issues at their clubs or at their professional athletes also. First of all, I want to do a disclaimer. But why is my presentation here? A disclaimer: this is not based on solid evidence. This is just our experience, and most people who are familiar with talks from my side usually would expect a strong academic background. Today, it's completely the other way around. It's just what we experience at our club. So to understand a little bit more about how it was in Holland, we need to have the timeline for at least professional football in Holland. It's in Holland. It started at 15 March. Suddenly, all clubs were closed. The league was cancelled, and at this period, restart of the league was unknown. So all the players went home, were not allowed to come to the club, and should all their training also at home. And one major issue in this period was that there was a lot of uncertainty for the players, because we did not know whether the league would start again in several weeks or that it was expelled for a longer period. So the main issue in this period was uncertainty. Then 4 to 5 weeks later, at April the 21st, there was a definite decision that the league was cancelled for this season and should not start earlier than September. And there was a second change that for professional sports, training at the club was allowed, but there were a lot of restrictions, not for the smaller kids in the youth academy, but for the adults and the adolescents. There were a lot of restrictions. So this is what we call the restricted team training period. That's what we're still in. And where are we working towards? We hope that soon the COVID pandemic numbers are getting better, and there will be some possibilities for unrestricted team training. And in the end, hopefully in September, we can start competition again. But this is still a question. So we're still in the restricted team training period. So the challenges I want to discuss today was, first of all, what everybody was focused in the beginning was maintaining player fitness. And especially in the first part, a lot of attention was faced on the physical fitness in this period. But along the way, we experienced that mental fitness was even a bigger challenge and probably even more important to manage for the players. Then I want to share something about the challenges we had with infection prevention and management. And this will be mainly infection prevention, because at the club we did not have any proven COVID infections yet. Probably also due to the limited testing policy in Holland, but also we had nobody with major symptoms, only some people with some mild respiratory tract infections. And a third challenge, nowadays probably the most difficult on a daily basis, is how can we comply to the COVID measures at our training facilities and keep all the people who are at the club doing the good things. So first I will focus at the physical fitness. From the start, when the players had to head home, we immediately gave them all the materials they could need to do their daily training at home, at least their fitness training. So every player from the first team got a watt bike, they got dumbbells, elastic bands, kettlebells. So all the material that's usually on the club, they could take home, so they could continue their physical training. And in the first weeks, and this is what I call the uncertainty period, all the training was focused on being ready to restart the league. So there was a lot of focus on speed, explosiveness and power, change of direction, exercises as far as possible to do at home. And this took 4 to 5 weeks. But after 4 weeks, when we knew the restart of the league was expelled at least to September, there was a downgrade in the intensity, the number of trainings we advised the players to do, and it was more focused on a maintenance program. And the main challenges we faced in this period with the players, what they indicated that they found it difficult to do their programs because there was no clear end goal. They did not know for how long they should train this. They did not know where they were aiming at. Would I be able to play matches again, or is it just a period before I can go on holiday? So they missed their goals for training. And the second part was that training at home is boring. So a lot of same training, and what they also mentioned is the boring part is that there was no competition at all in their daily programs. So what was our practical purpose to face these challenges? I think the most important thing we experienced was that introducing competition was a factor that really motivated the players to do their physical trainings. So what we did was physical training challenges. So this means on a weekly basis, several challenges where they had to do some strength training, for example, heavy strength training with how many repetitions you can do, and you can challenge other players within the team. They should make videos, and by this there was some competition. Also competitions on running, so exercise, long endurance training exercises, so who could run the fastest, a 5K or a 10K, for example. So this really helped the players to give some motivation and give them their competition that they're actually always used to have during their daily work. Another thing what was quite nice to mention is we, within the professional sports, other sports face the same problems. So with the first team, we organized a cycling event online with the professional cycling team. It got some media attention, but this was also, a measure or a tool to get out of their daily boring trainings and get some other ways to compete. Then what I also mentioned was the mental fitness. First, we really focused on this physical fitness, but during the first weeks, we really, in talks with the players, they indicated that they not only were boring, but they had problems with being locked up at home, especially the guys who were from abroad, who often usually only had their partner at home, no social contacts at all. They really felt to be locked at home. And the second challenge was what people indicated they were missing was their team environment. They're always used to be in the team room, in the locking room, at the club with their teammates, and this was all gone. And is there a way that we can simulate this team environment? So we tried multiple things, but the things we think were quite positive to face these challenges were, first of all, we organized weekly online meetings with the players in groups, and we experienced that 6 to 8 players is a good number to have an online meeting. If you take more players, their attention is less, and 6 to 8 players is a good number for them to exchange their experience, to share their experience, to have some peer support, to talk with each other about the problems they're facing in this period. If necessary, of course, we did some individual guidance, but a lot of players, they indicated that too much individual guidance, they don't see their positive experience for that. They were not eager to do that, only if there was really an indication for that. And this was especially for the first team when there is a lot of personnel. So what we experienced in our women department, a lot less of staff, less trainers, less coaches. So the individual guidance and the meetings in small groups of players were less likely to organize. But what in women football was experienced positive was that they did the questionnaires of the profile of mood state. Also, especially because in the women teams there were more problems with anxious and depression. And this was in their department a good way of monitoring their players. And if there was an indication that depression or anxious symptoms were present, they could do the individual guidance with those players. And the fourth thing that was probably the most helpful is we created a virtual team room. I will focus more on that. This was a simple Instagram account, only for the players and staff in the team. And this virtual team room, there was a lot of tools that could be used. First of all, it stimulated the social contact between the teams. So all birthdays were over there. Players and staff would make video logs to share their experience during the COVID period. Chat functionality where they could chat within their groups. And of course, they could also do that on their own accounts, but we noticed that creating this within the team improved the social contact between the players. So also challenges, physical challenges were posted in this virtual team room. Players could challenge 2 or 3 other players or staff members to do some physical exercises, but also technical skills. Some people uploaded some nice technical skills from videos they made at home, or some nice technical skills from other players from the past, and they could imitate that. Also an environment to continue on football tactics. So once a week there were video analysis of previous matches shown in this virtual team room. So they could also get their brain ready for some football tactic stuff. A nutrition, home cooking. Most of the players are quite used to the team restaurant here at the club, so not very used to provide their own meals. And to prevent them to have some junk food every day, we stimulated them to also do some home cooking, and some clear videos from our staff from the kitchen from Ajax were uploaded every week. And inspiration videos from, for example, the director of the club, or some great players from other clubs were uploaded several times during this period. So there was the part about how to get physical and mental fitness, to maintain this. So the second part I want to discuss was the challenges we face with infection prevention management. The bottom line was quite easy. We strictly followed all Dutch measures against the coronavirus. And for prevention, still these are the basic rules that apply for everybody. So what we indicated, stay at home if you have cold-like symptoms. Stay near home as much as possible. Only in the period that they were allowed to train, they should come to the club and then back home as fast as possible. Keep their 1.5 meter distance from others. And of course, the hand hygiene. And what we experienced, and also for myself, even if to remember all the basic rules is sometimes quite difficult. And if people ask me what are the basic rules, I can indicate this 4 very easily, but there are probably some more basic rules that are changed during the time, and every time I have to look on the website. And we're sure for one thing, our players will not watch websites to look for the basic rules. So in my opinion and my experience, they can think about 4 rules, and that's the maximum. So really focus on the most important ones and repeat this every time. The big challenges in this part was of course the fake news that was also already pointed out by Paul, and the infodemic, and especially around the football club. All players, trainers, staff, they have a lot of contacts who are giving them advices or focusing them on some new stuff that's in the news. This was really a challenge, how to manage all these thoughts and expectations from players and staff regarding all this infodemic issues. And the second part we faced in Holland was, of course, the discrepancies with other countries regarding the policies. A big issue in Holland was that we had a limited testing policy from the Dutch government. The main reason was that there was a limited testing capacity in our country, and the government said only testing if there is an indication in people with sort of severe symptoms, so no preventative testing. And this regulation of no testing is only changed on the 1st of June. So all the period before, we were actually not allowed to do testing. And there was a lot of exceptions made for professional football in other countries. For example, in Germany, they could restart the league. There were special policies made for professional football, and in the Dutch government just did not do that. And I think we made it ourselves sort of quite easy. We had just one rule, and that's what we communicated to everybody, is that we strictly follow government guidelines and no discussion about that. So if there was some new stuff or things done different in other countries, we just always repeated, we follow our governmental guidelines, and there is no discussion about it. And also the directors of the club and people who have some important roles within the club, they were all agreed on this. So actually, we did not have a lot of discussions within our team and with the staff about which policy or which measures to take regarding infection prevention or the testing in this way. But still, sometimes guidelines were unclear, or how should we translate guidelines to professional football practice? Some guidelines can be interpreted on several ways. How we deal with this? What we from the beginning find very useful was that we had a football physician WhatsApp group of all the football physicians involved in professional football in Holland. And here you see a screenshot of my phone, and what you see is this WhatsApp group was started at the 15th of March, exactly the day that clubs were closed and the COVID regulations involved also football. From day one, there was a lot of discussion and questions and answers on this WhatsApp group. And what we agreed with all the sports physicians in this WhatsApp group was that we should have all the same policies at our clubs. So if there was a question in one other club, should we do testing, or how about the numbers of people who can train? If this was unclear based on the regulation, it was immediately posted on the WhatsApp, and usually within a few minutes you get answers from the other clubs how they deal with it, or we made within a few minutes or sometimes within an hour we had consensus about a specific issue. And the leading guy in this was the head of the medical department of the National Football Association, Edwin Goedhart. He did a very, very great job to get everybody in line, and if there were any questions that were unclear, he would pick it up within the Football Association a group, discussed about it and made a protocol, and that was shared. And I really, really would encourage also some other countries to uniform your practical measures with your peers from other clubs. We never had any issues that there were measures taken differently on different clubs and any discussion about that. Really useful. And also something we should take into account in the future for any other medical related issues, probably. So we're facing some upcoming challenges. Actually, the first team now is on holiday, but we are starting in 2 weeks again with the new season. So first of all, guidelines for testing in Dutch professional football. It's still work in progress. So what we should do to start competition, I still cannot say anything about this, but this will be probably coming up in several weeks. For us at the club, after holiday, a lot of players will return from their home countries, for example, Brazil, USA, Portugal. Those are still countries that are on a red or orange list according to the Dutch government. So they, according to the rules, they have to stay in 14 days of quarantine when they come back. And we're still thinking about, is there a possibility to safely avoid the need of this 14 days? So this is what we closely discuss with our virologist at the Academic Medical Center. And what it looks like right now from their expertise is that if we do a PCR at arrival and a PCR 5 days later, and if they are both negative, and of course without symptoms, the players, that this might be safe to participate in training again. So we can reduce this 14 days of quarantine to maybe 1 week. What we also already have ready to start is an app for daily monitoring of respiratory tract symptoms. Very easy for the players. Each morning they have to fill in a few questions about the respiratory tract symptoms. If they have no symptoms at all, they can just push one button. So it takes them 1 second to provide this information to the medical staff. And at least it means that they have to think about, oh, do I have symptoms every day before they go to the training. Okay, then the third part, also an issue at the club, and how can we comply to all the COVID measures at our training facilities? Usually it's a lot of people here on the training grounds with all different kind of functions, and this is really an issue how to organize this at the club. So the challenges are, first of all, from a logistic approach. And the second challenge, and I think everybody working in sports will probably recognize, how do we get our players, staff and employees working at the club to comply to all those measures we ask from them. For logistics, I think the main practical pearl we experience is that we started to think what is really essential to provide a proper training, because that's what we should provide them right now, just a proper training, and all other stuff around that's not necessary we should probably just remove from the club or not get access to the club. So only essential staff. This means that during training you don't need 10 trainers on 6 players. We could provide them, but it's not needed. So only the essential staff. If we look at the staff for medical staff, we have a lot of physiotherapists, massage therapists. We have also several doctors. But in this period, there is not a lot of injury. There's not a lot of complaints. So only restrict them to the medical staff you need on the day. So a lot of physiotherapists should not be every training on the club, but we should divide it, and only the necessary medical staff is over there. And this also indicates for all the other supporting staff that's on the club. Only essential monitoring. In professional football, there's a lot of monitoring, GPS, heart rate, monitoring of subjective readiness, name it. We have a big staff of scientific staff that provides this monitoring. What we agreed that in this, especially in these first weeks, it's useless to all do this monitoring. It makes no sense. So even if they really want to come to the club, we indicated we don't need any science staff in the club in this period, so please stay at home. Only essential treatments. This is, of course, especially for the medical staff. No massage. That's not really indicated for some injuries. So, and actually it's quite good that we see that a lot of work we usually do in a professional football club is often not very essential, but we can discuss this probably in future more. Then how we get the player, staff and employees compliance to all the measures. I think this is the main pearl we experienced at our club, that we should make them feel responsible. So especially in the Dutch mentality, if people say something you have to do and you don't want to do it, or it's really an external stimulus to do something, Dutch people really got a little bit stubborn. They don't want to do that. But what we really felt was within our club that if we can make clear that the players and staff are responsible for a successful and safe environment, they were more likely to comply to all the measures. So what we really focused on is spreading of the disease is directly related to their behavior. Yeah? When we first came at the club, they just thought, okay, COVID is a medical issue, so this is the responsibility of the medical staff. No, spreading of the disease is directly related to how they behave at the club. Second, they are a role model, especially for the first players. They are a role model, not only within the team, but for the whole country. So they should really be aware of that. And if they still not get, we get them in line with the measures, they still not comply, we can be a little bit more strict and said, yeah, the direct consequence of non-compliance is that the risk is that the club will be closed. And nobody wants to do that. And if you don't want to get the club closed, just make sure you do the right thing. Example for this was some keepers trainers who always used to give their training without hand gloves. And they just said, I don't wear hand gloves during my training. And then we just make clear, if there will be someone with a camera catching you without hand gloves, giving training, putting the ball in your hand, we get the risk of getting the club closed. Do you want to be the guy who be responsible for this? Okay, very clear, no. So since then, not an issue with this guy. Explain why. For a lot of people, especially the youngsters within the club, they don't see any COVID-related issues in their social environment. So after several weeks of being at home, don't see any COVID-related issue. Why should I do all this stuff for something I don't see? An example, what we did for the under 23 team was, we made a vlog about our work in the hospital. Sports physicians from the football club also supported the intensive care unit at the hospital during the difficult times in the COVID pandemic period. And we made a video log about this hospital, our hospital experiences. And we really saw that within these youngsters, first COVID was something that was very far away from them. But then they saw that this issue was at the hospital. They're visiting always for their issues, that the doctors who are helping them during their football career are also facing the issue with people dying from this infectious disease. And this really made a change within this team, that they were really aware of why they are doing all these measures to prevent this serious disease for other people. And yeah, what we saw always when you start some measures in the beginning, people are more likely to comply to the measures, but keep repeating, especially the need of basic rules every week, every day you see the guys. That keeps them, at least aware that it's still an issue. Last point I want to share with you, some remarkable observation, at least in our Ajax Academy. In our Ajax Academy, we have 241 players right now. What we saw when we started training after the COVID restrictions, we only saw 2 out of all these 241 players who were unable to fully participate. And this is really a big discrepancy with what we usually see when there is 10 to 20% of all the players who cannot fully participate in training. And especially these are a lot of complaints regarding growth-related issues, so the morbus osgood-Schlatter or the growth-related heel pain, but also groin injuries, all gone. So we are really thinking right now, and I think we should do science in future for this. Is this a positive side effect for being not playing football on an intensive level for several weeks, or is it a sign of significant underloading? So can we expect a lot of other injuries in the next coming weeks? And we are monitoring it right now. I'm afraid it is the last one, because we saw a lot of increase in overuse injuries already after starting for only 4 weeks of training. But maybe some other people have some experiences in this. Okay, to finalize, I think the main practical purse you can maybe use at your own clubs or professional sport environment. First of all, don't forget the mental fitness. It's the most challenging part. Everybody focus on physical fitness when they're unable to train at the club, but don't forget this one. Keep contact online. Nowadays, there are a lot of possibilities to arrange this, and we did it with the virtual team room environment on an Instagram account. It works quite well. Regular group meetings, so they can meet their peers under supervision of someone from the staff. At least in Holland, we have, I think, some quite good guidelines from the government. And if you indicate to everybody we strictly follow those guidelines, there will be less discussion about several other measures you might or might not take. That's all on the internet or in the news. Harmonizing your actions with all the professional club medical staff within your country or within your league, for us was very helpful. And as last part, make the player, staff, and employees feel responsible to comply to all those measures. So this is where I would like to thank everybody for their attention, and I hope my talk will give you some guidance on some useful tools to use in your daily practice.